The clavicular and sternal heads of the pectoralis major are the prime contributors to shoulder horizontal adduction. The muscles can be tested together or separately. In patients with a cervical spinal cord injury, each head should be assessed separately due to differences in nerve root innervation. All gravity-resisted tests begin with the patient supine. When simultaneously testing both heads of the pectoralis major, the patient's shoulder is abducted to 90 degrees and the elbow is flexed to 90 degrees. The patient horizontally adducts the shoulder through available range. If tolerated, the examiner provides resistance just proximal to the wrist, opposite the direction of motion, while the other hand palpates for pectoralis major activity just medial to the shoulder joint.
Move your arm across your chest. Hold it. Don't let me pull it back. And relax.
When assessing the clavicular head, the patient begins with the shoulder in 60 degrees of abduction and the elbow flexed. The patient then moves the arm diagonally up and across the body. The examiner applies resistance above the wrist in a downward and outward direction. The clavicular fibers of the pectoralis major are palpated under the medial half of the clavicle.
Move your arm up and in. Hold it. Don't let me pull it down. And relax.
Assessment of sternal head function begins with the shoulder abducted about 120 degrees and the elbow flexed. The patient moves the arm diagonally down and in toward the opposite hip. Resistance is given at the wrist in the opposite direction. The sternal fibers are palpated on the chest wall at the lower anterior border of the axilla.
Move your arm down and in. Hold it. Don't let me pull it back. And relax.
When the strength of the shoulder horizontal adductors is grade 2 or less, the patient's capacity can be evaluated either supine or seated. In supine, the starting position is again with the shoulder abducted and the elbow flexed approximately 90 degrees. The clinician supports the forearm by gently grasping the subject just proximal to the wrist. The initial angle of abduction and angle of pull will influence which portions of the pectoralis major are activated. Palpation will confirm the muscle's contribution.
Try to move your arm across your chest and relax.
For grades 2 and below, shoulder horizontal adduction can also be assessed with the patient seated and their test arm supported on the table. The arm is placed in 90 degrees of abduction or in scaption, and the elbow is slightly flexed. Friction of the table surface should be minimized. The patient attempts to horizontally adduct the shoulder while the therapist palpates the anterior aspect of the chest medial to the shoulder joint to confirm pectoralis major's contribution.